I'm joined with cardiologist Dr. Falusa Fakaridi. Good morning to you.
Good morning. How are you, Bryce?
I'm good. Now, with all the talk of COVID-19, people are possibly neglecting other health issues. And as we know, people in the Delta, there's a higher risk of cardiology problems, heart disease and examples. But what about the peripheral artery disease going on?
That's a great question. Peripheral artery disease is probably the most prevalent, the most costly, the most deadly, and the most debilitating condition that most Americans have never heard about. Basically, the definition of peripheral arterial disease is when you have problems with your circulation that leads to blockages in the arteries, mainly to your lower extremities and your legs and your feet. If it narrows and it impedes or prevents oxygen-rich blood flow to your legs, it causes symptoms such as leg pain, such as non-healing wounds and ulcers. And if that is not picked up on time, that can lead to an amputation. And so the definition is very important because it's a problem that is similar to cancer. The analogy is important because most of these patients do not know their symptoms until it's too late. Two, a lot of it affects older population, so people over the age of 60. And we have the risk factors of peripheral arteritis, mainly diabetics, who have underlying chronic conditions that are getting worse. And the rate of diabetes and the rate of amputations have only increased over the last decade. So it's a very important area to all health-related institutions and also the community because it impacts our productivity and the lives and livelihoods of many.
Now, you mentioned a lot of times signs are hard to pick up on. What are some signs? Maybe people can figure out some early detection. What can people do?
Sure. The first thing you have to do, and especially something that we practice here, is you take off your socks. You take off your socks and you look at your feet and you determine, okay, does one leg look darker than the other? You feel the temperature. Does one feet feel colder than the other or cooler than the other? You also have to look at your hair growth in your legs, especially in men. Those who have less hair growth than they normally would in another leg, that is a sign of poor circulation. When the toenail growth is abnormal. And also when you have problems with other organ systems like heart attack, heart blockages, strokes, kidney disease. 50% of the time, the processes that causes blockages in other arteries in the heart and in the neck also causes peripheral arterial disease. So those patients also have to be screened. Now, some additional symptoms are if you have problems, difficulty walking, or if your leg gives out, if you've been told that you've had arthritis and it's not improving with all the therapies, you might want to look at being screened for peripheral arterial disease.
Can people who are very active, have a lot of exercise, maybe have a healthy lifestyle? I know sometimes people are just at risk of blood clots, but can they also be at risk of PAD?
Sure. So the PAD is the buildup of fat and cholesterol, and it's less likely a clotting problem, but more likely fatty cells and calcium buildup. And the risk factors for those are diabetes, high blood pressure, high cholesterol, patients who've had the same processes in their heart causing coronary artery disease or heart attacks. If they've had the same processes in their neck, it causes a stroke, and kidney disease or on dialysis. Those are the patients who are most at risk. In terms of younger patients who are less than 50, who have no significant risk factors, who are healthy, they have a very less chance of getting peripheral arterial disease, although they need to be cautious because after the age of 60, you will start building the process of accelerating plaque buildup and eventually might need to be screened for peripheral arterial disease.
Now, say someone recognizes a symptom or you diagnose them with peripheral artery disease. What is the treatment for it?
Great. The first treatment is we try medicines, and that is when you have either mild or moderate evidence of the disease. And so you try and give them therapies to decrease their cholesterol or decrease the fatty cell buildup. You try and encourage them to exercise, so an exercise regimen. But when they have a severe form of the disease, which we see a lot especially in communities of color or low socioeconomic communities, which is prevalent here in the Delta, we see the severe forms. So patients already have a significant amount of blockages or have non-healing wounds and ulcers. The first thing we have to do is to do a procedure called ultrasound to determine if they have blockages. And if they do, we then escalate that to an angiogram, which is basically a roadmap under an X-ray machine highlighting where the blockages are. And then using a technically sound procedure, you can go in and unclog those arteries. The key to unclogging those arteries is to restore oxygen-rich flow to your legs or your feet. And so you can get that antibiotics going in to help you, or you can get your medicines going to the site of where that blocked artery is. If it's not done on time, it will lead to an amputation.
All right. Well, I want to thank you so much for being here today. I also give a shout out to your t-shirt. It was perfect for this, but thank you so much.
Thank you. We always encourage people to stay healthy, live healthy, and knowing that saving lives saving limbs also saves lives. So thank you very much for the opportunity to share this with your community today.